Alright, I'm in hospital to get a disgusting lump cut off my neck. And no, it's not my head. Anyway, you gotta keep a sense of humour in this place. So before I go in, I'll show you what I'm wearing. I've got my robe on and also some massage socks that are massaging my feet right now, helping the blood flow. Check them out. They actually feel really comfy. Now, the anaesthetist has just been in and told me that I'm going in about an hour, and it'll take about 5 seconds for me, but it'll take about an hour to 2 hours for them. So essentially, they're going to dislocate my neck, put tubes down my throat, and cut out. So, yeah, I'm glad I'm not going to be awake for that, but let's explore our surroundings. I've got to be very quiet because there are people all around me, so I can't. You have to be quiet while I walk. So, let's look at where I am. See that? Now I'm in the start. So when they wheel me out to the theatre, I can't film there obviously, then I'll be in recovery. And so I won't be as peppy or, talkative as I am now. And I'll have a nice big scar there and dressing. And anyway, the nurse just looked at me like, what the hell is he doing? So I better go. But you know what? I'll keep you posted. I'll see you on the other side. I have no idea what's going to happen. And trust me, I will not be as spooky as I am right now. But I will still film, just so you can see it. Anyway, it'll be nice to look back on. So, I'll see you then. See you on the other side. Everyone, it went really well. I'm just in recovery now. All these tubes are inside me. It's, I'm all dressed up. It's about 12 o'clock, 12:30, I think. I've been wiped down, very stiff neck, as you can hear my voice. But I've got oxygen pipes, I've got tubes everywhere. But yeah, probably couldn't have gone smoother. It was a huge lump. And face is a bit dirty, a bit bloody, yeah. No, it went well, and I'm feeling good. I'll show you the TV. This is a bit, so I can't get up to pee, so I've got this here. So yeah, tell you what, the most painful thing about this was this. Now, they were very, very painful needles, but still it's okay. So yeah, I'm in good spirits. Very good people here, very good nurses, and I'll chat to you when it's a bit earlier and I'll show you what I have for breakfast. By that I mean I'll have it on a plate on here. So yeah, it's all good. It's all good. Can't wait to see everybody back there. And yeah. Rock on. See you in the morning. The late morning. Morning everybody. It's about 6:30 in the morning, and in a few hours I'm going into my room, which I should have gone into last night, but they wanted to keep me under observation. It's alright, I'm feeling a lot better.
A bit stiff, but a lot better than I was last night, I'll tell you that much. Now, here's where I give a bit of a warning. I'm gonna record. For all you squeamish people, I'm gonna give you a warning. If you want to look away, I'm gonna give you to the count of 3. But basically, I'm gonna film the wounds, where I was operated on, and also the needles in my arm. So if you don't like the sight of blood, I'll tell you to look back when I'm not filming. But if you don't like the sight of blood, look away in 3, 2, 1. Look away. Okay, now that was basically the entrance point. They put a tube down my throat, right there, and also cut my throat there, and down there, and in my arm here. 2 needles, an IV tube. Still a bit of blood there. Okay, you can look back now. All right. Those who look back, basically just for people who are interested, and for me for future reference and what they did for me. But yeah, so yeah, all you people who were squeamish, don't worry, you can still look. Now, I want to show you this very interesting sign over here. You can't read it because it's too far away. Basically, it says, "Please crawl, don't fall." So essentially, telling patients to crawl out of bed rather than fall out of bed. It's like, well, isn't that kind of obvious? You know? But I'll also tell you something ironic. For those people who saw, for those people who didn't look, I have 2 needles in my arm. Now, I've also got an ice pack on my chest. Now, the tape they used to take off the ice pack was more painful than the needle they put in my arm. Now, that's ironic. No, it was only a minor surgery, and yeah, well, I can tell because I feel a lot better. I feel, the anticipation of it all, as a lot of things, is way worse than the actually what they did. But I'm glad the thing is out of me. I'm glad it's not going to bother me anymore. And I'll film a little bit more, and I'll film an ending to this. So I'll film my room again just so you can see it. So there we go. I'll see you guys a bit later. What a view, eh? Hi everyone. Well, as you can see, I'm out. I've got all those needles out of me. There. And out of that hospital smock and into normal clothes. And as you can see, it's bruising a bit. And yeah, I feel good. I'm still on medication, still on painkillers. I feel good now, but I don't know how I'm going to feel later on. But no, it all went well. Now, the reason I was in the ICU all night and you never got to see my room is because I never got to my room. Because there was a bit of a complication. Well, everything went well with the operation. It didn't go as smoothly as it should have, but they just wanted to keep me overnight for observation, so I never got to my room. Stayed all night in the ICU, but I was, well taken care of. I had a TV up there, and I had the nurses watching over me all night and everything. So it was good. Now, the reason I didn't film more of the hospital is because, well, it's a hospital, and obviously, it'd be pretty disrespectful to film with people there who are sick and trying to get better and that. And but what I wanted to film but didn't film was all the Christmas decorations they had up. Or they had like Christmas trees and tinsel and all that. And it just made me think that thinking hopefully these people will be all better and out of there by Christmas. And also kind of hit home that how to keep safe, and I hope you all keep safe and have a happy Christmas, and I hope they obviously get out and keep safe and have a happy Christmas. And it's because it's not fun. It's not fun being in there. It's not fun for anyone being in there, especially during the holiday season, well, in any season really. But it's just, you know, you'd miss a beautiful day like this. And, you know, you're stuck with IVs and all this, and yeah, just, so I encourage people just to be safe and be happy and love your family, and yeah, well, that's about it now. There's also something else I want to say, but it's, I can't remember, but yeah, that's basically the general message to, oh yes, thank you for the support on Facebook and everywhere else, and, you know, it was nice to know that I had, like, a nice little support group there, and I could go check on Facebook, at any time, and yeah, it's really nice, and I really appreciate it, and that's why I encourage everybody, friends, family, all your friends, all your families, stay safe this Christmas, and have a merry one, and a Happy New Year, because as far as 2016 concerned, you can suck it. I'm over you. I think we're all over you. Go away, 2016. Go home. You're drunk. Okay. Anyway, that's all I've got to say. So thanks. Hope you enjoyed this little journey. And be well.